Net Health says 5 cases of cyclospora have now been reported in East Texas, but they do not appear to be connected. Tonight, KLTV7's Emma Burns tells us how Net Health tracks each case to look for a source and what to do if you start feeling sick.
The Northeast Texas Public Health District monitors diseases in East Texas year-round, working to prevent outbreaks of nearly 100 reportable illnesses. Net Health spokesperson Terrence Ates says the goal is to catch problems early before they spread through schools, workplaces, or restaurants.
It's a lot of investigative work. It's a lot of detective work of trying to make sure that we do not have any local outbreaks.
It starts at your doctor's office. When a test comes back positive for a reportable illness, like a foodborne infection such as cyclospora or a respiratory virus like COVID-19, Net Health epidemiologists are notified.
This is Net Health. I am calling just to follow up with a recent illness that you had.
Then they work with you and your doctor to see if it's connected to other cases or a common exposure to find the source.
That type of info is what our epidemiologists learn after they get in touch with a person to try to identify what the actual source of the infection was.
After identifying what diseases are active in the area, Ates says the most important part of their work starts with prevention to stop or slow the spread of infections through education.
Majority of those reportable conditions are preventable through hand washing, but also through vaccinations.
Ates says if you're feeling sick, don't tough it out. Call your doctor so you can start feeling better and so health officials can quickly track any spread. Emma Burns, KLTV 7 News.
Net Health says if you have symptoms that are getting worse or not improving, call your doctor and ask whether testing is needed, and be prepared to answer questions about any recent travel, food, or close contacts.